The Parliamentary Select Committee on Lands and Forestry and Health has paid a working visit to the Pantang Hospital to have a first-hand information about the land encroachment issue that sparked serious agitations a couple of weeks ago. The chairman of the joint committees said they aim at finding a lasting solution to the encroachment problem before it deteriorates further.
The Pantang Hospital, which was officially opened in 1975, has 344 acres of land, which houses the hospital, a nursing training school, and other health facilities. Some years later, private individuals and companies encroached on the lands. Several attempts by staff and management to evict them have proved futile. Barely 2 weeks ago, there were controversies over the encroachment of the hospital lands, which resulted in a strike action. This and a few other reasons prompted the Parliamentary Joint Committees on Lands and Forestry and Health to visit the hospital. The acting director of the Pantang Hospital, Dr. Frank Banning, said they had gone to court on several occasions to stop the encroachment, but to no avail.
In here, the frontage is all taken. The sad bit is, even some of our old buildings are said to be on other people's land. Buildings that were built somewhere in 1969-70 are said to be on a private developer's land. And the court says it's not ours. And I'm wondering, I mean, we bought the land way back. The contractor came to site. And it beats my imagination how the contractor would have developed outside the boundaries of our land. You know, and because of all these going on, security has become an issue.
The spokesperson for the joint unions at the hospital, Mr. Elvis Ekwamwa, lamented over the needs and the poor conditions of the hospital.
We are being told by management that this hospital is heavily indebted to the tune of over 3.5 million Ghana cedis. And as a result, logistics to work with have become a challenge. We also have complained that our infrastructure is deteriorating. If you see the conditions under which nurses and doctors and other staff work in this hospital, it's deplorable. So sometimes you're in a consulting room seeing patients who have come to hospital. It even gets worse when they are burning. The whole place is filled with smoke. Our internal roads are bad, inadequate human resources. We are in a hospital where there is only one clinical psychologist. One. We don't have a trained occupational therapist. And yet these are complementary therapies for mental health care. There are hoods and chalets where they can get marijuana. And we call it a hospital. Patients are lying in a bed in a physical OPD and they have to endure blaring sounds from bar operators in a position where it's said to be not the property of the hospital.
Both chairmen of the Parliamentary Joint Committees on Lands and Forestry and Health assured the management of the Pantang Hospital that they would do everything in their power to halt the encroachment.
We do not want a very important institution like Pantang to be in the news for all these wrong reasons. So our visit here this morning is to have a chat with you, to see things ourselves. We didn't wait for the speaker to refer the matter to us. We decided to come to represent our people, to make sure we are serving our people in the best way.
Committee members and officials of the hospital then inspected lands being encroached upon.
We need to understand how the acquisition was done, how many years the lease, whether compensation was paid. We need to investigate all this. Because sometimes when they don't pay compensation, you see the landlord coming back after the expiry of the lease period. So we need to investigate all this so that we get the solution. But I promise we will do all that within a short time.
During the tour, some people were seen working on the illegal structures. Members of the Parliamentary Joint Committees on Lands and Forestry and Health asked them to stop work immediately. Most of the illegal buildings have been completed, while squatters have also taken over some of the structures. This building was put up by Professor Bedu Akose's administration to serve as a conference facility, but was abandoned due to the stench from a nearby dump site. While at the site, one Mr. Kwame Kwenu, who allegedly sold the hospital's lands to private individuals, and companies came around. According to him, the BNI has taken some of his land documents for investigations. Members of the Parliamentary Joint Committees on Lands and Forestry and Health said they will soon meet those concerned in the land issue so they can find a lasting solution to the matter.